Good morning. It's certainly an honor to me to be here today and give the 2011 hands-on lecture as a University of Minnesota alumni. 2 years ago, since I joined the university again, and after having worked in the industry for 10 years, I joined the university in 2009 in the middle of the pandemic flu situation. And it was striking to me how little, in some way, as an industry, we knew about certain things, and more when we would be comparing influenza to other diseases like PRRS and so on. I had worked with influenza before at PIC, and even we had done some programs on influenza elimination. And even at that time, I came to realize there were many things we didn't know, specifically on influenza transmission and so on, that to me were crucial as an industry that we need to understand and we need to know how to address. So I will be talking a little bit about that today. So what I have presented, what I would like to do today, talk about influenza, give a bit of background about how we got here today. As you know, influenza is a complex subject. And then I also want to talk about what we are learning at the University of Minnesota and working with many of you on the research side to try to make sense about what happens in the field. And then, the last but not least, perhaps discuss a bit about what should we do as an industry to deal with influenza. Okay? So I'm sure the events of 2009, they are still fresh in the mind of many of you. We were in the middle of the pandemic just 2 years ago, and at that time, some of the headlines, as you can remember, the pandemic flu had been named swine flu, unfortunately, but that's how it was named. And it had a significant drop, as you remember, on exports. Certainly there were many issues going on in countries like Egypt. They decided to slaughter all the pigs because of influenza, or at least that was the excuse. But anyways, the events of 2009, I think we should have changed without any doubt how we look at influenza as an industry. Okay? If the view hasn't changed, I will say that then there is something wrong with our industry. Okay? And we know that even in the fact that, as I said, the disease was misnamed, and certainly, as some of the news came to realize later, we should not have blamed the pig for what was happening. Okay? So what happened in 2009 certainly made some of us much more skeptical and willing to cooperate, and in part was due to the media reaction and all the effects certainly in exports and on the profitability of the producers. And remember, 2009 was not a good year for producers independently of influenza. But at the same time, I think for others, certainly at least for me and for others, was the tipping point that we have to do things different as an industry. Okay? So despite the unfortunate and inappropriate naming of the 2009 pandemic as swine flu, and certainly the devastating implications that the misnaming had for producers, as an industry, I think we do need to reconsider what we do for flu, since influenza is certainly a serious problem for the industry. So whether we like it or not, and this, so there are some truth with the virus, is whether we like it or not, influenza is costly. Okay? In 2005, Dr. Tara Donovan presented some numbers about the cost of influenza in their system. In that case, some estimates about $10 per pig back then. So, and then we presented some other numbers when we did the project about getting rid of influenza before and after, and we also saw an economic advantage of being influenza negative. Okay, and the data as well from the system in Canada when it became infected with the pandemic flu, again, they did see an increase in mortality. So whether we like it or not, it certainly influenza is costing money. And the systems that they have started to evaluate how much influenza is costing, they are coming to realize that, yes, it's there, and it certainly is expensive, or it can be expensive. So that's something we need to understand better. Again, whether we like it or not, influenza is widespread in swine herds. When we look at the literature or the studies that they've been published, it's certainly widespread in North America, in Europe, in Asia, in Latin America, and now as well in Australia. So this virus is a virus that is in the pigs, whether we like it or not. Another one that sometimes we don't want to hear about it is that whether we like it or not, and we know that, influenza is an important zoonotic risk. Okay? The pig plays a central role in the ecology of influenza. Pigs can become infected with the viruses, influenza viruses of different origin, whether they are avian origin or pig origin or human origin. And then when they get infected by more than one virus, different viruses at the same time, then there is the likelihood to generate new reassortants, where basically it's new viruses that might be completely different from what they started with, but they are very different, and then they have the risk, again, to transmit back to other species, transmit to pigs, and cause zoonotic infections and cause pandemic infections. Okay? So whether we like it or not, pigs play a role on that. And more recently as well, and some of you might be aware of the news that there were just a few cases that were identified just 2 weeks ago in, I think it was Pennsylvania and Indiana. Those were an H3N2 virus of swine origin that infected children. Okay? And this actually, H3N2 virus, it was a reassortant with the pandemic virus. So again, this appears to be a case in which a virus from the pig directly transmitted to children. Okay, so whether we like it or not, those events happen, and we have to recognize them. And certainly, they have a risk. And fortunately, there wasn't, as far as I remember or I know, there wasn't any death on any children, but that's certainly a possibility that we have to face. Okay? So it would be wrong to say that nothing has changed in pigs and the industry since the 2009 pandemic. In fact, there has been concerted efforts to tackle flu globally before that. Okay? So we've been doing things as an industry. And this started, as I said, some of the surveillance programs, for example, they started even in 2005, I think it was, trying to get ready back then for the H5N1 hypopathogenic influenza, avian influenza. And then there was this network that's called OFFLU that was created by the OIE and the FAO organizations to have all these laboratories and experts as part of it to be able to identify and be ready in some way for these new isolates. First, to find them, but second, to be able to respond when these new isolates would appear. And more recently, swine influenza has been added as part of this surveillance effort. And we are fortunate in the U.S. to have, for example, Dr. Mary Grammer and Dr. Amy Vincent to be part of this network. So as an industry, we've been doing things, and there are things in place. As well, the recent USDA, CDC voluntary surveillance program, again, that's been a major advance to be able to get things to start working in the right way. And as well as the researchers, there's been studies that proactively since the 2000s, since the appearance of some of these new strains, that took place. Okay? So as an industry, we've been doing things, but I will argue that surveillance is not enough, okay? So it's good to know what is out there. We certainly need to know what is out there so we can learn from what is out there, but it's not enough. What we've seen, that we've certainly improved in many systems in our biosecurity, but I will say that the current biosecurity practices, and certainly even the vaccination practices, appear to have limited efficacy. And the reason why I'm saying that, because if anything, we have more viruses, not less, okay? And we have more problems, not less. And in many systems, it's more difficult to deal with those problems, not easier, okay? So something is not working, or something is that we just don't understand it very well. Okay, so we need to figure out. So we certainly, I think, we do need a much more profound understanding of influenza epidemiology and how the influenza viruses move in these complex swine systems that we have today. The industry, and I will allude to that in a little bit, but has changed dramatically in the last 10 to 15 years about what we do from the point of view of pig movement and how we raise pigs. That certainly has impacted what happens to influenza and other diseases, and we have to recognize that. And as in the industry, it's obvious that this is a challenge that we're facing, but certainly also it's an opportunity, and we have to look at it that way. So how did we got here in the first place? And I just will quickly try to review a bit about the virus, the pig, and the environment. This is a slide that you've seen before. It's courtesy of Dr. Amy Vincent, that summarizes what we know about the virus, or in some way the evolution of the viruses in the US. As you may remember, the Spanish flu, one of the first pandemic that was recorded in 1918, the H1N1, the classical flu, that virus was introduced in pigs, and it stayed in pigs for pretty much a long time, almost non-change, okay? And it was in late 90s, 1998, when some of the studies show that, okay, well, we do have a new virus introduced, and we had this H3N2 virus that was a triple reassortant. So up to that point, the viruses that we were finding, the flu viruses that we were finding in pigs were the classical H1N1, but at that point, that was a tipping point in which we start seeing some much more diversity, specifically the introduction of this H3N2 of human and avian and swine origin. So there was this reassortant. At the same time, there were other, the H1N1 started reassorting with the H3N2, and we start seeing much more diversity. Then a few years later, in 2003, 2005, we see the introduction as well of these viruses of human-like origin that, again, they tend to reassort and exchange genes between others, and then increase the diversity of flu viruses that we have in the field. And with that, the challenges that represents to control influenza. And more recently, we had the 2009 pandemic virus that, again, had genes of avian, swine, and human origin, and created new challenges. And just so you know, this is a virus that really likes to move. And it's very promiscuous to a certain degree, because it really likes to mix up with the other viruses. And that's what we are seeing now. There has been new reassortants identified of the pandemic H1N1 viruses with whatever viruses might have been already in the population. So what we end up having is all what we had before, plus some additional new reassortants. So we have to see that. And then the picture, again, this is a slide courtesy of Dr. Amy Vincent. It becomes very complex, and we have all these different clusters, alpha, beta, deltas, gammas, and so on, of different origins. But very quickly, and this happened in the last 10 years, so very quickly the situation becomes even much more challenging and difficult to deal with. And then when we look at the submissions as a reference, for example, this slide, courtesy of Dr. Marie Kramer, the submissions of isolates that reach the diagnostic lab here in Minnesota, we do see that it's a widespread. In many cases come infected with H1N1s or H3s or H1N1 or H1N2 on the H3 viruses. So again, very widespread, very diverse situation, difficult to deal. And again, this is a slide that also speaks to that, to try to group the viruses according to the group. But my point being is that we do have a very diverse situation of viruses circulating in the field, a diversity that has been exponentially increased in the last, let's say, 10 years. Okay? So that's about the virus. But what have we done as well from the production point of view that we cannot forget? So remember, again, in the middle of the 90s in particular, we've gone from a single-site production to a multi-site production. And with that, we have increased the number of sites in one end and the number of movements of pigs. And then your neighbor, it's not just right next to you, but it might be your neighbor in Iowa, because it was just the distance what it took to transport the pigs. So all of a sudden, we are moving a lot of pigs. And this is actually data from the USDA here up to 2003 that illustrates the number of shipments of livestock, but in particular the increase, if we look at this chart on the upper left, this speaks about the number of shipment of pigs that increasingly, again, increase exponentially as an industry. And it's a reflection of what we did in the industry too. Again, it had many advantages to move from one site to three sites. So I'm not saying that we have to go back at all, but we have to recognize what has happened from a disease point of view, that when the systems were designed, they were designed to control more the endemic diseases, not so much the viruses that we are dealing today. So we have to understand that, okay? The other thing that I want to point out, again, because of all this multi-site production and the fact that we are moving many pigs, and today actually Dr. Martha Nelson will be giving this presentation, that she described the spatial dynamics of influenza viruses introduced in an area, how then they got disseminated throughout the Midwest, okay? But again, I want to point out, and this is to illustrate the role of pig movement, and again, I'm not trying to steal her thunder, but certainly encourage you to go to her presentation today. But what this study talks about is what happened in the introduction, in this case, of two viruses, one H1N1 in the southeast region. Basically, the study reports North Carolina, and then H1N2 in the south central region, that both viruses were from human origin. So what happens in those viruses, this study very nicely shows how those viruses were disseminated to the Midwest, okay? And then how widespread they are. And the point that I'm trying to make is that really the Midwest, because the way how our production system works and the way how we move pigs there and the way how we have set up the farms, it certainly serves as an ecological scene for swine influenza viruses. And we bring all this diversity of viruses to the Midwest, where we allow all these viruses again to reassort and generate new viruses. And again, we provide in some way the conditions that the virus wants to change and come up with new viruses. So we have these opportunities for genetic reassortment. Okay? So, and then the point of the study is that this genetic diversity of swine influenza viruses in the Midwest is continually increased by the importation of viruses from other source populations located in the South. Okay? That again, this is obvious to us given that that's where many of the pigs that were raised in the Midwest originate from. So that should not be coming to a surprise. The other thing that we did when we created these systems, and back then we knew very little about it, is that we have this component of regional airborne spread of diseases. And Dr. D showed that very well for pathogens like PRRS and Mycoplasma, the 9 kilometers aerosol spread. And we haven't seen, or we haven't proved that for influenza, but certainly it's a virus that has that propensity, and I will talk a little bit about that as well on the research side. But again, the systems, and for some of these pathogens, we have created those conditions in which we favor, in one end, the movement of the pigs via transport, but at the same time, the aerosol spread when we place these pigs. And on top of that, we do have larger farm populations with higher density. And what I want to mention here is the dynamics of the infections. As you know, they change significantly from small populations when you take them to larger populations. And for influenza, that's certainly the case, and that's where we've done, or we are doing quite a bit of research in our group. So that's my next step about what I would like to present is what are we learning about influenza in relationship to all these points that I think they are relevant to understand how the viruses move. So at the University of Minnesota, we have the group that works on influenza, transmission and surveillance. Dr. Marie Grammer and myself work together, and then on this, try to understand what's going on out there and how the viruses move and how the viruses get maintained in populations. And then we have a very vibrant group of graduate students that also contribute to this effort. Dr. Matt Allerson, Cesar Corso, Susan Detmer, Andres Diaz, and Ana Romagosa, okay? Which Dr. Detmer and Romagosa already graduated from the program. And what I would like to do next is just to talk about what we are learning, okay? But the more important, when we sat together and tried to figure out, okay, where do we get started? We want to understand what's going on. We were very interested in understanding just the ecology of influenza at the sow farms, okay? Where are the viruses, okay? How are they maintaining the pig populations? How are they moved? So very, very basic questions that, again, we knew better the answers for viruses like PRRS or even Mycoplasma, but we knew very little about influenza. So one of the first studies we did, we identify sow farms, a few sow farms, and this is the work of Dr. Matt Allerson, in which it's those sow farms that back all of us, okay, that they are not the acutely infected sow farms, but are more the endemically infected sow farms. And we basically wanted to know where the virus was, okay? Those are the farms that, yeah, we know they have a history of influenza, but it's hard to find it. Sometimes you find the virus, sometimes you don't find it. So we did a cross-sectional study in which we took samples, a significant number of samples of the different subpopulation of animals, including sows, gills, so basically gestating animals, and then the piglets in the farrowing, okay, and at different times. So we wanted to see where the virus was. And consistently in the farms that we tested, we could not find the virus either in sows or gills. Again, these were not acutely infected farms, so it wasn't a recent infection, so were the farms that were endemically infected. So we could not find it in the sows or the gills. Where we could find the virus, it was in the baby piglets, in the neonatal pigs, in particular in the pigs in that week prior to weaning, okay? And the prevalence, when you look at the numbers, the prevalence was low. And this was looking at the positivity, looking at the nasal swabs. It was 10% in one case, it was 6%. We're taking 60 samples in every visit in each of the age groups. So it was a large number of samples and very easy to miss in reality. So, and then even we had a testing, and I will refer to this later, in which when we tested this, what says day 56, that we could not even find the virus. So the test were targeting a 5% prevalence, and we missed it in that situation. Okay, but my point is that the neonatal pigs, okay, prior to weaning can be a reservoir of influenza. Okay, and certainly it's one way that we are documenting on how the virus moves, and that's something that I think is important from the point of view of starting to think in terms of control strategies and where do we have to get started. The other thing we saw in this population of animals prior to weaning, and I just will mention the results from the pink colors, that's a distribution of HI titer of the piglets at weaning. Okay? But again, we do have a huge variability, I should say, on the levels of HI antibody titers, to the point that in this case in particular, 30% of the animals had HI titers below what was supposed to be considered protective, even though that's not a clear cut either. Again, we have this diversity of immunity in these animals that has implications for the transmission side. And this is another slide to illustrate that, again, the animals would become positive, virus positive, as the levels of antibodies would decrease. Okay? But the point, again, I'm trying to illustrate that the neonatal pigs serve as a reservoir of influenza viruses, certainly help to maintain those enzootic infections in the breeding herds, but they also are a source of virus for the wean populations after weaning. Okay? And the point is that it's very easy to miss the level of positive in those pigs because they are very few pigs. The prevalence at weaning is low. Okay? And then there is this significant variability in the antibody levels at weaning that certainly has implications for influenza transmission and dissemination, and I will go back to that in just a second. Okay? So we have that. We have the sow farms. We put the piglets out. That a small percentage of them are positive. And then we want to know, okay, once we place these pigs in a wean-to-finish facility, how long does that wean-to-finish facility stay positive? Okay? So, and remember, as I said before, influenza, the dynamics of the infection are quite different, whether it's a small population versus a large population. This is a self-limiting disease, and just for the reference, for the ones, just a reminder, the virus, when it infects the pig, usually it lasts 7 days, okay? 5 to 7 days, the pigs have the virus, but then after that they should, when we do experimental infections, the virus is gone, okay? So the virus tends to die out in a small population, but certainly the dynamics change in those large populations, and that's what we wanted to know in this study as well that Dr. Matt Allerson did, in which we're trying to look in this population of wean-to-finish population, a large one, we wanted to know after placement for how long we could find the virus. And we look at it looking at both nasal swabs or oral fluids. The nasal swabs are the results in blue. And if we just look at oral nasal swabs, we basically found the virus for the first 16 days. And this is actually, by the way, the first set of samples that when the animals, they were taking about 3 days post-placement, they were already the 10% positive. This is the same group of animals that was tested in the sow farm that I mentioned before, and we could not detect it. So in very few, just that weaning period, certainly the prevalence went up. Okay? But more interestingly than that, and then we stopped taking nasal swabs at that point. We had 2 consecutive negative testing of nasal swabs, and we stopped taking samples of nasal swabs, but we continued taking samples with oral fluids, and that's what we saw. When we look at the results from the oral fluids data and see for how long the virus, were able to detect the virus in that population, so basically up to 70 days in this study. We've looked at other populations. Another population, it was 42 days. Again, depending on the size and so on. But my point being is that the virus stays in the populations quite a long time, even longer than perhaps we thought so. So that's something that we need to take in consideration, this prolonged detection of the infection in the growing pig population. Okay? This other slide that I want to show you, and some of you might be already familiar as well, is the work by Dr. Marie Grammer and Cesar Corso, Richard Webby and Jim Lowe, this is this active surveillance program of influenza that is in place right now here in the US. And it speaks about the same point about the commonality of finding the viruses in sites. There are 30 sites being tested on a monthly basis, and each dot represents the testing of, of the site. And the color, when you see a color, it represents when they found a new virus, or the sampling, there was at least one sample tested positive. And the different colors, it just illustrates the different strains, okay, or the different subtypes. But this picture really tells that in the same site, we can find different viruses. We have this dynamic situation of viruses when we monitor this population. So in this study, so far, at least 80% of the herd have been positive at least once. So again, it speaks about the commonality or the widespread distribution of influenza. There's been influenza virus, you can detect it throughout the year. Before we used to talk about the seasonality, but when you look at the data from the diagnostic lab or this study, certainly influenza is there year-round and can be detected in both vaccinated and non-vaccinated herds and with animals with and without clinical signs. So again, and then we have all this dynamic profile of strains in which we see the new strains and the new reassortants. Okay? Again, a very complex situation that we find the virus is everywhere. Okay? And then some of the data that also is published that sometimes we don't want to look at it, but it's also out there. When we look at the data from the market pig surveillance, it's common to find 2 to 4% of the pigs, when we slaughter them, to be influenza virus positive. Again, studies here in the US a few years ago, and the studies ongoing in Asia. Again, the animals stay, or the population of animals can stay infected for prolonged periods of time. Okay? So in conclusion, endemically infected herds are common. Certainly there is more subclinical flu than previously thought. Wing pigs play a role in the dissemination of influenza virus. Often they are these silent spreaders, if you will, in which they are able to spread the virus without you really seeing anything obvious from the clinical sign point of view. And then we're also finding that the duration of virus detection in these populations is longer than what we thought before, or what we see in research settings, that certainly it's much shorter. Okay? So again, trying to understand what happens in these populations, we want to see the role of immunity. I alluded before at these piglets with these different levels of immunity, and certainly immunity playing a role about the transmission or the dynamics of the infections, and we're interested in evaluating the effect of immunity on the transmission parameters in pigs. And we look at different models using experimental settings, whether pigs, vaccinated pigs, whether we had piglets with maternal derived immunity, and as well in convalescent populations. And to do that, as I said, we set up studies to look and calculate what we call the reproduction ratio, which basically is a measure, it's a number that allows you to estimate the expected number of subsequent infections caused by one infectious individual during the infectious period. Basically, it tells you whether a disease or a virus or an infectious agent will spread or not based on this number. If the R value is below 1, above 1, the infection will spread. If it's below 1, will die out. So this gives a sense about the dynamics of the infection that happens in those populations. But I won't go in detail in this study, but just show some data when we look at the effect of pig vaccination under this setting. The blue line represents the group that had no vaccine, okay? And in those conditions, we see transmission very quickly, which is what we expect. The virus comes in a population and infects everybody very quickly. When we have levels of partial immunity, which is the red line, we see a delay of transmission. So we are able to slow the transmission about how the virus moves in those populations. But the transmission still can take place. And this study in particular, when we use what appear to be animals fully protected, we did not see the spread. Okay? We also look at the effect of maternal immunity. Again, we add a level of complexity here, and to try to mimic the situation of maternal immunity, pre-farrow vaccination is a common measure. And then in this case, what we saw that the piglets that were not vaccinated or that were partially immune, we saw, and it's the red and the green lines, we saw the pigs becoming infected very quickly. Okay? And that actually, I would think, that's the most common scenario that we see under field condition. And these pigs probably didn't have any sort of clinical signs. In blue, in this case, the pigs that had what we call the homologous vaccination, still some could get infected, but the infection was slower. And in this table, I'm just trying to summarize that, saying that when we look at it, most of the pigs, and look at the value, the R values, the first one on the heterologous group, even the groups with partial immunity, the virus was able to spread. Okay? But it was delayed, so which is the good thing, or the good news, I think, from this study, and an application on how vaccines can be used to try to decrease the transmission of influenza under the right conditions. And the same, on the other hand, though, on the case of the passive immunity study, for the non-vaccinated and the heterologous group, transmission happened very quickly, but on the homologous group, and you cannot see it there, the R value is 0.8, so below 1, although the interval confidence is very wide. Again, the possibility is still of the virus to spread, even in the presence of maternal immunity that was considered homologous. Okay? So what we saw from these studies, very quickly, we saw that vaccination reduced transmission rates. However, transmission can still happen in the presence of the immunity. And again, we also saw it in this study, the maintenance of the virus in these partially immune populations may be prolonged. Okay? So this certainly has implications for the epidemiology and the surveillance of influenza and things that we have to take in consideration. But what I would like to say, too, that vaccination is a tool that we have to explore the use of vaccination when we can put it in combination of management strategies to help both the reduction of transmission and then finally with the dying out of the virus in those populations with the assistance of those strategies. Okay? So the last study, or one of the last studies on transmission, again, I talk about the role of the piglet when we move them to the finishing sites, for how long the infections can stay in those populations, start bringing some insight, try to explain what happens in those populations from a point of view of the dynamics of the virus when we have all this partial immunity. Okay? But we are also interested in understanding more about transmission. And in this case, the work that Cesar Corso is doing to look at influenza aerosol spread, again, trying to understand what may happen in these areas with high density. And we follow some of the work as well, Dr. Scott did, using the ERSI clonic, and we validated this methodology to detect influenza from air samples in both experimental settings, and now we are working in testing in the field. Just to show you a slide to help to understand the shedding or the detection of influenza virus from infected pigs from nasal swabs compared to what we detect in the air. The samples and the color blue refers to the results from the pigs in the nasal swabs, and the samples in red shows the detection of the virus in the air samples. And again, you can see that basically both curves agree very much. Okay? So again, illustrating that when the viruses are infected, those were negative negative pigs, and they got infected, they shed a lot of virus. And the other thing it shows is that you do need a minimum threshold level that in this study was, I think it was like 20 to 30% of the population in this study needed to be positive for us to be able to detect it in the air of the infected pigs or the infected rooms. So again, another tool that helps to study the role of aerosol transmission, and what we are doing now is actually going to the field and trying to see what's the relevance of this route of transmission in the field. And Dr. Cesar Corso will present this data in the next session, but again, illustrating that influenza, it's in the field. We can detect it inside barns and as well on the exhaust air of the infected facilities. But there are some things about the detection of influenza from aerosols that are much more encouraging and hopeful, I think, than for PRRS, for example. Okay? And we can talk about that later, too. So in summary, what are we learning from our research is influenza virus is ubiquitous, so it's everywhere if you look for it. Infections are prolonged and maintained in populations of partially immune pigs. So we have these animals that in some way they are these silent spreaders, okay? And we can detect the virus as well in the aerosols of infected populations. Okay? And we still have many questions that need to be answered, and we are working on it. Okay? So, but the big elephant in the room that I haven't talked about it yet is the role of people. Okay? And this is quite different as a disease that a swine disease that we are not quite used to deal with it. Okay? When we compare to PRRS, people, you know, the actual role of people as a source of infection, it's not important. But for influenza, it is. Okay? But we do need people to help with the pigs, so we cannot ignore it. And if anything, this is an area in which we have to understand better, and we have to do more research on. We know that people can infect pigs as well, and that was obvious during the pandemic, that most of the cases that were reported, it was the people that infected the pigs. So it can happen, okay? But one of the things we need to understand as well is that not all the strains of viruses that infect people infect the same way pigs. So there is a lot of variability about the capability of those strains to infect the pigs. But we saw from the previous study that those human-like strains can spread in pigs. Perhaps they get introduced in a population, and then because we move the pigs, then they become much more prevalent. Okay? But the other thing that I think it's very interesting are the studies from Norway and Australia, in which the population of pigs, they were considered influenza negative until 2009. Again, suggesting that it is possible to have population of pigs negative, or that in those cases the people or the viruses that infected people were not easily transmissible to the pigs. Again, we do need to understand what's the real risk of people, and that's an area we certainly need to address and do more research. Okay? So the real question, what should we do about flu? Okay? And that was supposed to be the goal of the presentation, and I'm running out of time, but we'll talk about it, okay? So, and this actually, I certainly don't have the answers about what we have to do, but I want to throw some food for thought and things that I think we need to take in consideration and that we need to start working on it. Actually, for the ones that were able to go to the flu clinic yesterday, there was a survey, and we will follow up as well on an email to all of you, an email for an electronic survey in which I'm interested in knowing your perception or your thoughts about what should we do about flu. So I would appreciate if you could fill out that survey. But I'm going to give you a proposal, and then we can go from there and let's discuss it. Okay? So the first point is that as an industry, we cannot ignore flu. And that's what I was trying, by providing you with the information I provided you with, I was trying to make the case that we cannot ignore flu and we have to continue working in flu. Despite the fact that the events of the 2009 pandemic have passed, we cannot dismiss what had happened. Okay? The influenza infections are here to stay, unfortunately, but that's how it seems it's going to be. Okay? So we can just not say, well, we passed, we survived, we forget. No. Because as you could see from the events, even from the reports from those few children in Indiana and Pennsylvania, there will be these continuous zoonotic infections will happen. So we cannot ignore that. And at the same time, we cannot predict when the next pandemic will take place. or when there will be new strains emerging in pigs. We cannot predict that. There is a lot of work being done from the CDC perspective, trying to anticipate when the new pandemic will be or when the new pandemic will show up. But the reality is that it's going to be very hard to predict that. So my proposal is, our focus actually as an industry and from a research point of view, is that we should be developing and validating agricultural practices that help us in the prevention of transmission of influenza in pigs and from pigs to people. Okay? We should be working and understanding what practices work, and those practices or target and measurement should just not be reduction of clinical signs or performance. That's important, but we also should look at what happens to the virus. Does it move? Okay, are we able to shut down transmission of the virus? Because we will only be making progress in the degree that we can reduce the viruses that we have circulating. So my first proposal is, let's not ignore it, even though the events of 2009 have passed. Okay? The second one, we have to support and continue to support the surveillance efforts. Okay? So the efforts that we have at the national level, at the international level, they need to be supported. And they need to be on a unified approach. I'm being consulted by some countries sometimes in which influenza is not recognized and there is a specific producer, for example, that it's positive. What do we do? How do we report it? But the reality is this is not a producer's disease. This is an industry disease. And the only way how to deal with it is if we all participate and if we all show as a unified approach in which then not a single producer is singled out. And I think it's the case here as well, to continue on the surveillance efforts. But at the same time, we do have to be ready for the results, because the purpose of surveillance is to find new things. That's the purpose, okay? And with that, to learn more about the virus and to learn more about, how the virus moves. And certainly that will give us more insight about how the influenza transmits in pigs. And we need that knowledge. We need to know the role of the avians or the poultry or the humans. We need to know that. And surveillance can help us with that. But certainly it has public health implications, because we'll be finding more things, and there will be media reaction. So we do have to prepare for that better than what we had up to now. So that's something else to consider. And let's not forget that the health of our animals is our own health. Okay. Third one, and this is more for food for thought, and I try to put it as a PRRS-like approach. Maybe we do need to take a PRRS-like approach. And I'm not saying let's go to eradication or regional eradication. That's what I'm not talking about. So first point, what we did for PRRS, looking back, is try to understand where the viruses come from. Okay? Is it mostly a disease that is introduced with the animals, whether they are the weaned animals or it's replacement animals? Or is it really a disease that 90% of the cases it's because of lateral infections? I don't know. I don't think we know. Or it's really all about people. Or perhaps it's the birds. So we do have to understand, get a sense at least about what are the relative sources of introduction. Okay? But it does need to be a collective effort. And the good thing, I think, is what we're learning is that many of the biosecurity practices for PRRS might help us for flu too. So we are already ahead than what we were even 10 years ago. So I think that's in the good news. The concept of a PRRS-like approach, that's what I mean. Continue with the PRRS-like approach. And actually, this slide should have gone before the other one, so sorry. So let's get a handle on how much flu is costing. Again, the systems that have started to look about how much flu is costing, it can be a costly disease. Okay? So let's understand what the cost is. And even though we don't know what it will take to really make progress on this disease yet, perhaps if we target a measurable outcome, like in this case, I propose the production of negative pigs, similar to what we did for PRRS. or even the reduction of the number of circulating strains in a herd. When we start with some of these intervention strategies, we can start measuring if we're making progress on this effort. So I think we have to do that. And to start at the top, again, the role of the wing pig, even though it's the silent spreader, if you will, we need to, again, focus on what sort of strategies do we have to do to minimize the risk of infection in those pigs. So start at the top, meaning the stop at the sow herds. And then let's assess whether and how different practices and strategies will work. Vaccination. Do we really know how to vaccinate populations? I mean, we've been vaccinating herds pre-farrowing for a long time, but do we really know how? Some places, they use blanket. Some other countries, blanket vaccination. I mean, I don't have the answer for this, but certainly, or should we just do piglet, growing pig vaccination if we think in terms of area spread? And that's actually a complex study, a complex situation that we need to understand because of all the interference with maternal immunity. Again, it's not a black or white answer, but that's something that we need to understand and learn how to vaccinate and how to use vaccines, because those are certainly tools that are available and they have very good benefits if used in conjunction with other strategies. Herd closure. We documented the role of herd closure to eliminate influenza. Okay? It can work. Okay, but then what's the role of the piglet? Again, perhaps we should try early weaning. Again, if it's true that consistently we find the virus in those older pigs, maybe just a few groups of pigs that we do early weaning could be enough to eliminate the virus, or other measurements. And again, going back to understanding how the viruses get infected. So let's keep the viruses away and understand as well the minimum biosecurity we have to do for that. Other species, wild birds, I didn't talk much about it, but certainly there's been a well-known source of viruses through infection of water supplies, for example. So biosecurity must be a must. And remember, the other thing with these things, events that perhaps happen in Canada or in somewhere else in North America, doesn't matter. It's then how we move the pigs, the likelihood of those events of spreading. That's what makes this such a threatening situation, in my view. And the people, again, I already alluded to that, but keeping viruses away, the viruses that come from people, that's actually also, I think it's got to be a priority, but we need to understand more that interface, because again, not all the viruses move the same way, also easily. The role of personal vaccination is one of the things we can do. We did a survey last year here at the Leman Conference, and we'll be presenting the results today as well in the next session. Again, let's try to make that more convenient, and that's the purpose of us holding the flu clinic here. Is one of the things we found as part of that survey is that people don't get vaccinated often. It's because we don't have time. We're always late. It's never convenient. So, but that's one of the things we can do really to help and assist on that interface of prevention of the transmission at that interface pigs and people. And certainly understand the role of people in pigs. So let's be realistic. Influenza will not go away. And it's unlikely that it will get any easier. If anything, will get more complicated, at least judged by what we see in the field of all this diversity of strains and how these viruses like to reassort and come up with new combinations. Okay? And it doesn't seem like there are miracle tools in the horizon, and even if there were, we still would need to understand more about the epidemiology and the transmission component of this disease. So let's be realistic with it, and let's try to tackle it. And my last one, flu elimination. Is that the place where should we go? In my view, at this point, it's still premature to think in those terms because we have many questions to be answered. But if we really think about the virus itself, this is a disease that is self-limiting. The viruses, again, I said that before, in a pig, stays very few days, and it's self-limiting in small populations. And we know that the strategies like herd closure can work, and we need to do more work on it. But again, there are proven strategies that can help us to contain the virus in infected populations, and we also saw that the vaccines do have a play in reducing transmission. And our data would suggest as well, and we have to do more work on this, that aerosol spread is possible, but it might be less relevant that, for example, for PRRS, in which PRRS can be shed for a long period of time from infected facilities, and in the case of influenza, it seems it's more associated to the course of the disease. Okay? So again, so my point is that there might be scenarios or situations that having negative populations may be within reach much more closely than what we think. So that's food for thought on how to consider. Okay? And so anyways, I think it's 10 o'clock. In conclusion from my talk, this is my first message. Please, let's not ignore flu. Let's work on continue understanding how this disease moves in the systems we have today. We cannot take for granted what we learned many years ago. We've changed the production system significantly. So let's advance the research on transmission and certainly on vaccines. And I do believe that we do have an opportunity as an industry to make significant steps in controlling flu. And I think that's where the role of all of us it's important here. But again, we will only be making progress, I think, if we work on it. I mean, if we think, and I will use the example of PRRS, if we think as comparison where we were 10 years ago, we would have never thought about it. But all started because we started measuring things and doing things and controlling things and documenting those things. I think we do have to do similar for flu.